children, the common problems are, just like adults, they have growing up issues. They get the running nose, blocked nose, and a lot of kids, what they have is when they start going to school, especially daycare and all that, then they meet other kids, and as you know, every other kid has got a nose problem. He's got a runny nose, a sneezy nose. So they all pick up a lot of bugs from school once they start going to school. All these things happen when they start going to school and daycare. So they pick up all these allergies and nose infections and ear infections. And so it's basically a growing up issue. They have a lot of allergies, nasal congestion, middle ear infection. You'll hear a lot about this middle ear infection. They have glue ears, what we call otitis media with effusion, where they have, after the infection is settled down, they have fluid remaining in the middle ear, which is the part behind the eardrum and the inner ear, and that part drains into the back of the nose. So if the fluid in the middle ear doesn't drain into the back of the nose because of infections in the nose, because of an adenoid enlargement. Adenoids are tonsils that are behind the nose. And so what do? Then we treat. Quite often the mainstay of treatment is still medication. Treat the child's allergies and allow them to outgrow the problem. We step in if the child's problem don't go away or becomes recurrent, especially if they have enlarged adenoids that don't settle down with medication. Then you have to go in and reduce the adenoids. Or big tonsils that recurrently give you a problem and cause the child to snore or sleep with the mouth open. Then you have to go in and remove the tonsils and adenoids. If the child has recurrent ear infection or fluid in the middle ear that does not go away, then the child cannot hear well. And if the child cannot hear well, then they're unable to pick up their education. So we have to do something surgical. So the surgery is more or less a social indication here. It's to allow the child to hear better so that he can be educated better. Most of the time as the child grows older, a lot of them outgrow the problem. So surgery is kept to a minimum and we try and treat the child with medication. So allergies, nasal congestion and middle ear problems, tonsils and adenoids. These are the usual problems that most kids come in with for ENT.